Let's talk about heart failure. Heart failure is commonly called CHF, which stands for congestive heart failure. And in order to understand heart failure, I think it's important to first understand the basic anatomy and the flow of blood through the heart. If we peel back the layers and get rid of the external covering, you can see the chambers of the heart then with the blood flowing through the great vessels. And if we get rid of all that, we essentially have a picture of the heart that shows us just the chambers and the vessels that exit the heart, and it makes it easier for us to understand the flow of blood. So first, the anatomy of the heart. The heart is divided into 4 chambers, atria on top and ventricles on the bottom. On the left side, you have your left atrium and your left ventricle. Same goes for the right. You have your right atrium and your right ventricle. And blood is pumped in a very organized fashion in the heart. It starts in an atria and goes to a ventricle, and a ventricle pumps blood out into the organs and tissues in the body. So let's start with oxygenated blood that starts in the left atrium. Just got back from the lungs. It goes from the left atrium to the left ventricle. And the left ventricle, it then pumps out through the aorta into all the tissues in the body. It is pumped up into structures in the head and neck and face. It's also pumped into the extremities, upper extremities, and the blood that is pumped down goes into the lower extremities. And each of the organs in the body has a specific demand for oxygenated blood. And the heart's job is to pump blood to those areas that have the demand. It is essentially going to supply the demand. All these tissues then use up the oxygenated blood and pump blood back into inferior and superior vena cava, into your right atrium, then down into your right ventricle. And your right ventricle then pumps blood out into the lungs. So understanding that concept of how the blood is pumped in this circuit of the heart, it's easy to understand how heart failure works because it's the inability to pump blood to the specific tissues that have a demand for oxygenated blood. And that causes a backflow of blood through this circuit, leading to congestion or congestive heart failure. So to better understand this, we just can think about the heart as having 2 functions. The first function is to pump blood, and this is called systole. As I mentioned, the heart has to pump blood out to meet the demand of the body. So systole is when this muscle squeezes down. And the second function of the heart is to relax and fill with blood. And this is called diastole. So the heart has to adequately fill with blood. So this muscle here needs to relax and stretch out to accommodate enough blood for the next pumping action. So those 2 functions generate this circuit that we talked about, supplying all of the organs. And if it's unable to do one or the other of these 2, that's when you lead to congestion and a backflow of fluid leading to congestive heart failure. So when someone has signs and symptoms of heart failure, they go to a cardiologist, and a cardiologist orders a very important specific test called an echocardiogram. And an echocardiogram is a fancy ultrasound that is designed to look specifically at the heart, and it tells the cardiologist exactly how well the heart is pumping and how well it's relaxing. So an echocardiogram, as I mentioned, is an ultrasound of the heart. Looks something like this if you were just to imagine the ultrasound probe in the heart, and kind of what it would look like if you were in the office as you have a patient lying on the gurney there, and the cardiologist or the echocardiogram tech is able to put the ultrasound probe directly on their chest, and it generates a picture on the screen here. And that picture is what the cardiologist looks at and determines how well the heart is functioning. So that would look something like this on the screen. And as I mentioned, this echocardiogram is the most important test that we can do for someone that has heart failure because we're able to quantify how well the heart squeezes. And it's able to give the cardiologist a very important number. And that important number is called an ejection fraction. An ejection fraction, in the most simplest of terms, is just the amount of blood that is pumped out of the heart with each squeeze. To better understand this concept of an ejection fraction, let's think about it in a mathematical sense. So this picture that I showed you from the ultrasound, let's consider this bottom chamber our left ventricle. And during any given portion of the cardiac cycle, we get ourselves a volume of blood in the left ventricle. So why don't we just say this amount of blood is 100%. So when it fills up during diastole, we get a certain volume of blood in the left ventricle. And we'll call this our end diastolic volume, EDV. And with each squeeze of the heart, we pump a certain percentage of that out. So let's say with a squeeze or a systole, we pump out, say, 60% of that. That volume of blood there is pumped out, and we'll call that a stroke volume, SV. And the ejection fraction is just your stroke volume over your end diastolic volume. And this ejection fraction is important for heart failure because the normal ejection fraction, so we'll say normal, is greater than 50%. Now that's important to know because when we come back over here and talk about our two types of heart failure, the ejection fraction is referred to. So as we talked about, we have our pump action of the heart, which is systole. And if a heart doesn't have the ability to do that, it has a reduced ejection fraction. So its ejection fraction is less than 50%. And if you have a reduced ability to squeeze, if you think about that, you're going to get more blood in this chamber, which leads to a dilated heart. The other type of heart failure, we can have diastolic heart failure. So the other function of the heart, if it's not doing its job, it can also lead to heart failure. And this is when your heart has the inability to relax or fill. So this muscle here doesn't relax well enough. And this doesn't affect our ability to pump, so our ejection fraction is not altered. It's just the amount of blood that we can get into the chamber with a given diastole is reduced. So sometimes diastolic heart failure is called heart failure with preserved ejection fraction. With this type of heart failure, our pump doesn't have an issue, heart failure with preserved ejection fraction. We just have an inability to relax or expand, leading to a decreased amount of blood volume physically in there. So with diastolic heart failure, we have an ejection fraction that is normal. And if we think about this, we don't have the ability to fill as much, so we don't have as much blood volume in the chamber. Therefore, we're not expanding or dilating our heart out. And on echocardiogram, this looks like a less dilated heart. And that's really it. Those are the two functions that the heart has to do continuously in order to supply all of the organs and tissues in the body with their necessary requirements for oxygenated blood. The last thing we need to talk about is what causes heart failure. And the way this is easily divided is into two broad categories. The first category is called ischemic. And ischemic is from the word ischemia, which is a decrease or lack of oxygen to tissues and cells. And when you have a lack of oxygen to tissue and cells, the cells and the tissues die, and that decreases its ability to function. So our ischemic causes of heart failure, the most obvious one, coronary artery disease. And that's when you have a plaque that builds up and causes heart attacks, because this shuts blood flow down to the muscle of the heart, therefore causing cell death of the cells in the heart, which decreases its function. And the other one that would cause ischemic types of heart failure would be something like vasospasm, as opposed to coronary artery disease, where you have a plaque blocking blood flow. This is when the arteries that supply the muscle to the heart actually clamp down and spasm, again leading to a decreased amount of oxygenated blood to the tissues and cells, cell death, decreased function. And one specific cause of vasospasm to the arteries that supply the heart muscle is a drug, cocaine. And those are our two general causes of ischemic heart disease. And the other category we can break into non-ischemic. And these causes don't have anything to do with not delivering enough oxygen and cell death. These are actually causes that directly harm the heart muscle. So we'll say not related to decreased oxygen. And the non-ischemic causes, there's a lot of them. First of all, you can have toxins or drugs that directly harm the heart muscle. High blood pressure over a long period of time can lead to heart muscle damage. Diabetes mellitus, or DM. And then some other causes more common in the developing world and less common in the United States would be infectious causes. And some of the infections that are known to directly harm the heart muscle are things like HIV, tuberculosis, and parvovirus. Those are infectious causes that actually damage the heart muscle, leading to heart failure. And then the last category I think we need to talk about would be the unfortunate case when people are actually just born with bad hearts and they get what's called hereditary cardiomyopathy. And they are born with an altered structure in their heart muscle, leading to its inability to do what a normal heart would do, and then causing heart failure that way. So that's it. That is heart failure. And if you understand the basics of this, it makes understanding why patients experience symptoms with heart failure much easier.